Thank you, Mr. Chairman. Prior to being in Congress and prior to running a think tank, I worked for 2 international engineering companies, and this reminds me of something we used to kind of jokingly say during the time that I've worked for the engineering company. There's always time, there's never time to do it right, there's always time to do it over. And this is so typical of what Congress and the federal government does. We create a program. We don't take the time to evaluate the need. We don't take time to make sure that we design the program to meet the need. We just create a program, and we throw money at it. And then when they screw things up, we throw more money at it. You know, there's a lot of talk about the lack of bipartisanship. Mr. Duncan has introduced a sensible amendment to do a study and, in an engineering perspective, make sure that we design an effective and efficient program to meet the needs. I grew up dirt poor. My grandparents cooked with a wood stove. We got water out of a well. I understand that. Are you listening, Mr. Chairman? I'd appreciate the chairman's attention. Mr. Chairman.
Yes, Mr. Palmer.
I know that was an engaging conversation, but I would appreciate your attention to this.
I'm sorry.
These are serious matters. And my point is, the points made by my colleagues on the Democrat side of the aisle are important points. But Mr. Duncan's amendment is a reasonable amendment. All that we're asking is, before we create another federal program, for an agency that's admitted they don't have the capacity to do the program, is to take the time to do a serious, comprehensive analysis and make sure that we design an effective and efficient program, and not do what we do so often in Congress, is create a program, throw money at it, and if it screws up, throw more money at it. So with that,
would the gentleman yield to me a minute?
I yield. Mr. Chairman, I support the Bouchon amendment. Now, I'd just like to point out what Dr. Bouchon is talking about is singling out the fluoropolymers that are lumped in this bill with all PFAS. It's well established that these fluoropolymers that he's talking about that are used in medical devices and other very important devices and products that we need for day-to-day living do not present a significant concern for human health or environment. There's peer-reviewed research that indicates that they meet internationally recognized criteria to be considered polymers of low concern and for potential risk to human health and the environment. And what you're literally doing by not accepting this amendment and not recognizing that there's a difference between the fluoropolymers and just the general universe of PFAS chemicals is potentially denying people treatment that could save their lives. And so I just wonder, Mr. Chairman, if you were about to have open heart surgery, are you so committed to eradicating all fluoropolymers and PFAS that you would instruct your physician, no matter the consequences and potential outcome of the surgery, not to use any medical device that contains a fluoropolymer? And I would ask that of the Democrats, because that's literally what you're saying that you want to do to the general population, is deny them access to products that could save their lives. I yield back.
Would the gentleman yield one more time?
I will yield to the gentleman.
So I have a question for the sponsor of the amendment. I just wonder, as we pass 21st century cures, which impacted not only drugs but also devices, that would there be then a requirement for the FDA to reapprove all the devices that have been previously reviewed and approved if it had this material in it? Dr. Bouchon, would you know the answer to that?
Well, I think there's potential for that, yeah, of course. I mean, and there's also potential, I guess, that, like I mentioned in my comments, that declaring these products hazardous, there could be, retroactive lawsuits, millions of them, class action lawsuits for any patient that has had this previously used as part of their medical therapy, even though, as Mr. Palmer outlined, these are polymers of low concern, have never been shown a risk to human health, and are approved by the FDA. So I would say, yes, there's potential that that could happen.
It's just another reason why I think this amendment is worthy for us to, if not pass today, when the bill reaches the House floor, and work with the Senate. With that, I yield back to the
I thank the gentleman for yielding back, and a question for Dr. Bouchon. If this bill were to pass without this amendment, is there the potential that the FDA would require that all medical devices containing the fluoropolymers be removed from use, or at a minimum be required to be reevaluated?
I think they'd be considered hazardous chemicals and have to be recalled, yeah.
Mr. Chairman, again, I speak in support of this amendment, and I urge my Democrat colleagues to take seriously this amendment and the potential for enormous harm in the area of healthcare for patients who would need these products, especially if this went into effect immediately and we didn't have time to develop alternatives. I yield back.